My name is David Sasaki. I direct Boys and Men Online, which is a research and policy program at the American Institute for Boys and Men. We study and look for solutions in how digital technologies shape the lives of boys and men. Most of our work so far has been focused on sports betting, prediction markets. We've done some work on gaming and AI companions. And of course, we are gathered here today to discuss pornography, one of the most common online activities and the least discussed and least studied. So there is a lot for us to dig into today. I should clarify from the outset that we are neither anti nor pro pornography. As with all of the technologies that we study, we assume that there are healthier and less healthy ways to use these technologies. And we're really interested in understanding what can be done to encourage more of the healthy use and less of the unhealthy use. We are joined by a rockstar group of pornography researchers today. I will describe the format of the webinar so you know what to expect. And while doing so, I will introduce each of the participants. So we will first hear from Bailey Wei, a fifth-year PhD student in clinical psychology at the University of Nevada, Las Vegas, also an AIBM graduate student fellow, and the lead author of the landscape report that we published at aibm.org last week. Bailey will present her findings, and then we will hear from two expert discussants. Emily Rothman is a social epidemiologist at Boston University and a leading expert on how sexually explicit media affects young people's relationships. And Marc Potenza is a professor of psychiatry at Yale and a board-certified psychiatrist specializing in addiction psychiatry. So after the responses from the discussants, we will then hear from Shane Kraus, co-author of report and a professor of psychology, also at the University of Nevada, Las Vegas, where he is the director of the Behavioral Addictions Lab. Shane will walk us through the evidence gaps of what we don't know about pornography, its prevalence, its impact, and how we might try to address some of those gaps. Emily and Marc will then respond again, and finally, I will pop back on to facilitate the question and answer period. I would be remiss if I did not give a special shout out to Josh Grubbs from the University of New Mexico, who is the third co-author of this report and has just been really instrumental in informing my own understanding of pornography. And looking at the list of participants, I know I'm not the only one who feels that way. So Josh will also join us for the Q&A period at the end. And with that, I'm very happy to pass it over to Bailey to present the findings.
Well, I'm super excited to be here with everybody. So just getting into the findings of the landscape scan. So for prevalence, as maybe we would expect, many men and boys have viewed pornography. In fact, over 80% of men have seen pornography in their lifetime. So a lot of people have seen porn, especially men. Most have viewed in the past year. About 1 in 2 men have viewed pornography in the last week. And in adolescence, porn use is also common. This is a little different, though, as there tends to be more unintentional exposure to porn in adolescents and children. Unintentional exposure occurs by design of the porn industry, a peer, a partner, could be an act of grooming. However, some studies specify intentionality and others don't. So we don't have consistent prevalence rates on unintentional and intentional viewing of porn. But about 70% of adolescents report lifetime exposure to pornography, with the average age of first exposure being about 12 years old. Porn use is highest among younger men, so about from age 25 and younger, and then use declines with age, or tends to, at least in American samples. There's some differences in different countries that have been noted in the literature, and then it does persist across the lifespan, though. So some concern for prevalence of pornography use in the literature. There's a lack of consistency in language used to assess frequency, varying time periods, so like a year, a month, week, days. This makes it really hard to compare studies. Although self-reports are really valuable and helpful, we really do need some studies that use other more objective measures, such as web tracking, and there's some research more recently doing that as well. There's a lack of nationally representative research in pornography. A lot of research has been done using weird samples or Western, educated, industrialized, rich, and democratic samples. And some of the most representative samples that we have in pornography research are from the General Social Survey, but most of these studies actually asked participants if they had seen an X-rated movie, which is an outdated term. A 2025 study looked at the data from the General Social Survey and compared prevalence of X-rated movie to an experimental pornography question, and they found that 43% of men endorsed viewing an X-rated movie, whereas 65% reported viewing pornography. So this really does suggest that pornography and X-rated questions are different than, or perceived differently by participants. So moving into the associations, there's a lot of associational research in pornography, but that's one of the biggest drawbacks, that many of the studies are correlational, often cross-sectional, lacking longitudinal data. Much of the research has focused on negative correlates rather than the spectrum of associations. So Josh and Shane in 2021 created the figure that we see here and highlighted the gaps in evaluating the spectrum of relationships of pornography use. And not a whole lot has changed since 2021. There's some new research that has been added, but there's still a lot of gaps. So we're going to look at the associations. We've grouped them by individual, relational, and societal levels rather than the developmental research, relationship research, and clinical science and mental health. But those are all embedded into these different levels. So for individual level relationships of pornography, the research has indicated several negative associations at the individual level, including associations with sexual behavior and attitudes, which includes like increased number of sexual partners, condomless sex, perceived realism of pornography, recreational attitudes towards sex, as well as links to mental health concerns, including problematic pornography use for some. So problematic pornography use, which we can talk about more, especially in the Q&A if people have questions, but that can fall under the diagnostic umbrella of compulsive sexual behavior disorder, which is in the ICD-11. And then for positive and neutral associations at the individual level, the research has noted pornography can function as an education tool or can be used for sexual exploration, especially within LGBTQ plus populations, has been noted more often. So at the relational level, negative associations include increased rates of sexually aggressive behavior, endorsement of less progressive gender roles, lower relationship quality, decreased sexual satisfaction, poor communication with romantic relationships, increased relationship instability, and lower interpersonal satisfaction. Whereas positive associations at the relational level include greater sexual closeness and intimacy through increased sexual knowledge, enjoyment, and openness to sexual experiences. Some more positives here. And then neutral associations at the relational level include that pornography use frequency was not positively or negatively associated with men's subjective sexual and relationship satisfaction. So some mixed findings depending on the study. An important note here is that a lot of the research on romantic relationships and sexual relationships has been conducted in heterosexual relationships. A study of couples showed that men's pornography use related to less frequency in sexual activity in heterosexual relationships, but actually more frequent sexual activity in same-sex relationships, highlighting that sexual orientation could be a potentially important moderator for pornography effects. And then so at the societal level, we don't really know what the societal level impact of pornography is. This tends to be a common issue in research. It is really challenging to determine directionality and causality. However, it's especially true in pornography research due to the limited longitudinal research that we have. A central societal concern has been whether the availability of pornography is associated with broader social harms, particularly sexual violence and intimate partner violence. While some have argued that pornography contributes to gender inequality and violence against women, population-level studies have generally not supported a simple causal relationship between increased pornography availability and increases in sexual violence. In several contexts, rates of sexual violence have remained stable or declined during periods of expanded access to pornography, suggesting that macro-level trends do not mirror concerns raised at the individual level. So this has been mentioned throughout the associations, but there's a lot of room for research in associations of pornography use, including moving beyond associational research, looking at directionality of associations, given that much of the research is cross-sectional. looking at long-term developmental impacts and population-level impact effects. There is a lack of research exploring positive and neutrals of pornography use. So there are many reasons people report viewing pornography, including personality characteristics, such as erotophilia or positive attitudes towards sex, as well as sensation seeking and narcissistic tendencies, as well as emotional coping strategies, including stress reduction, mood management, and to cope, especially with loneliness and boredom. Sexual motivation, such as arousal, relief, pleasure, exploration, sexual enhancement, and curiosity. Education, possibly. There is some evidence of people reporting to use porn for sex education, but also many people report not having to rely on it as a meaningful source of sex education. Within LGBTQ plus samples, they may report using porn for exploration of identity and determining their readiness for sex. So there's a lot of different reasons people are reporting that they're using pornography. Okay. And then moving into the last section of content, at the state level, 25 states have passed age verification laws since 2023. Age verification laws often place legal responsibility on the platforms, but the laws tend to be vague, lacking guidance on the storage, transmission, and deletion of personally identifiable information required for verification. As a result, major pornography sites have blocked access in states with age verification laws, citing privacy, security, and liability concerns. This lack of access has driven some users towards VPNs and unregulated sites, potentially actually increasing the risk. So this is concerning. Although age verification policies could be helpful, there is a lack of research and evidence guiding the policy decisions here. Additionally, age verification currently places the burden on the platform. There are two types of age verification that would potentially not have as much burden on the platform, which are the attribute-based and age-verified devices. So attribute-based verification uses passcode-protected apps, which is already used for ID.me, commonly used in the US. A benefit to this is the personal data remains stored on the individual's personal device, rather than like if there was a policy breach like we saw with Ashley Madison years ago, it doesn't impact everyone, it would just impact that specific device. Similarly, age-verified devices involve a one-time process of confirming the device is used by someone 18 years of age or older and occurs at the operating system rather than through the website. So you go into Apple and you confirm that your device is used by someone that's 18 years of age or older. As a result, websites or third-party vendors would not collect that sensitive data, and age-verified devices would take the responsibility away from the sites and would not require the collection of that information. So there is also evidence for pornography literacy programs and public health campaigns, but there's been little support in implementing these at a larger level, even though there's actually a lot of great evidence for these. Additionally, qualitative research using parents and teens has highlighted a preference to have education tools for parents to help their kids navigate the world of pornography. So this is another great avenue that could use more exploration. So I will hand it over now to Marc.
So thank you, Bailey, for that wonderful overview and for taking the lead on generating this important document that serves as the basis of a discussion about where we are in terms of understanding pornography. This is a rapidly changing space. Over the past 10, 20, 30 years, there have been substantial changes with respect to how people consume pornography. And like with many aspects of digital technologies, in many ways, we're trying to catch up with respect to understanding the potential harms, as well as the trying to balance the benefits and harms and protect vulnerable individuals like developing youth. And help them navigate this changing digital environment. Coming at this from the perspective of a psychiatrist, as well as someone who is focused on developmental aspects, I think that there have been concerns raised with respect to the availability that of internet pornography And there are many aspects that we don't understand. Um, there have been concerns raised about developing youth using the internet and pornography on the internet as a means of sexual educations, and then having perhaps uh, not a full understanding of how pornography might relate to quote unquote in real life sexual encounters. And this may lead to potential harms. So, trying to protect developing individuals from potential harms, I think, is important for all forms of digital technology. And glad that we're having this discussion about pornography. In having this discussion, I think, as with many areas of digital technology use, we don't want to say that everything is bad and that consuming something is a bad thing if it is not harming individuals, but trying to understand the potential harms is important. So I will not take up more time. I'll hand the baton over to Dr. Emily Rothman.
Thank you, Marc. So I know that part of our goal here today is to take the contents of this report and start a conversation, I guess, that leads us to what should we be researching next, or what would a research agenda look like to take this even further and to help us all think about solutions. And just by way of introduction, I'm somebody who's been conducting research on pornography and sexually explicit media for about 15 years. But to give that some context, also on dating violence and sexual violence and commercial sexual exploitation. And so really thinking about the bigger picture of how are people treating each other, and how are people treating each other in sexual relationships specifically. So I think there's a lot to think about here in the report and the section of results that have just been presented to us. And I guess what I found myself thinking about most is, sexually explicit media is one factor that's affecting whether we're talking about men and boys or we're talking about young people. And it's important. So it doesn't affect all individuals in the same way. And that's something that often gets left out of the conversation or discussions about what the research says about sexually explicit media. The scaffolding that individuals have is really important. And what I mean by scaffolding is, who are they talking to or not talking to about what they're seeing? What resources are available to them? And I'm thinking about parents. I'm also thinking about siblings as possible sources of information or setting norms, peers, teachers, schools, community. There are all kinds of other institutions or supports sometimes around people that either give them additional ways to be critical and think about what they're seeing and experiencing, or help reinforce some of the negative stereotypes or harms or behaviors or other things that they're seeing in sexually explicit media. And so it is one piece of a larger constellation that we have to think about. And it also means that has implications for how we think about solutions. This isn't a really important discussion because what we're doing is we're setting out the base layer, the foundation, what is known already, and that's an important conversation. One of the things that this may be a little provocative, as if a conversation about pornography, how could it be made even more provocative, but I'm going to try my best. I think, and you feel free to disagree with me, we might have enough research that investigates, is it harmful? Is it not harmful? Because the answer to that question is, certain types of sexually explicit media are harmful for some people in certain contexts, and we've established that. There's other ways and other contexts in which seeing sexually explicit media does not cause those same harms for other people. And the more attention is now needed to what do we do about it when harm is caused? What are the evidence-based ways of moving forward? What are the effective ways of helping people? And what can we learn from the people who are able to be resilient or able to be critical thinkers when they're confronted with sexually explicit media? And for me, that's what's really engaging. And I don't want to get ahead because I know the next portion of our discussion here today is going to be about um, evidence for, what we can do. So I'm really looking forward to that piece of the conversation. But anyway, as we're all gathered here to think about this base layer, the evidence about harms and how textured that is, I think the implication is that in many ways, the next exciting frontier is what are we doing about it? How are we engaging with people to give them the help that they need and the education that they need? And that can be different for different subpopulations. There's not a one size fits all answer to that. Okay, so I've probably gone on long enough. I'll stop myself there. And looking forward to the next section. I forget who I'm supposed to toss the mic to.
I think that goes to me. That was perfect. Thank you for those nuanced and really intriguing. I don't know if provocative, but a lot of fodder to think about. And Bailey, I promise you, we will give you space to react to both of those comments. But Emily really set up Shane perfectly for the next segment here on future research directions. So Shane, have at it.
What an amazing setup. It was like just perfect. So yeah, I think this is our first conversation. This is our first step. We want to have a conversation, really kind of set the platform and think about what are the things we have to do here. So what are the core gaps? So I would say there's lots of gaps, but I think we can kind of break it down into four areas and we'll discuss it. One of the big things, in graduate school, you hear correlation, not causation, over and over. They beat it into your head. And I think that's really true. A lot of the research is cross-sectional, and it really means we need longitudinal and more causal research. That's hard to do because it's really expensive. It's really hard to do, but we really lack it. And I think a lot of other areas where we've looked at things, substance use, alcohol, gambling, other things, have really kind of had that investment for longitudinal. And longitudinal research helps us because we get to see how things change over time for people, right? And as mentioned earlier, like who are the groups that kind of develop a problem and who don't? And then what are the factors that cause that? So really kind of more experimental designs. I think there's other approaches and we kind of dive into it in the report. The other thing is we really, like I said, there's more limited on positive and neutral outcomes. And it makes sense. I'm a psychologist. So when people come to see me about addictions, they're often not doing well. I've never had someone come to therapy and say, my life is amazing. And I just want to talk about it, right? That's not kind of what we do. So as researchers, we often focus on problems, and that makes sense because we want to help people be better and feel better, and including how we study pornography when those have issues. But at the same time, that also means sometimes we're narrowing some of our fields and thinking about if pornography is working for people, why, and what aspect of it's helpful for them, in the relationship. So I think that's really underrepresented. The other thing is really around diverse populations. And, so much literature was on student populations and younger people. And I think a lot of work is missing on older adults, other populations, people from different communities. So really thinking about that and how do we do deeper dives into pornography research for boys and for men, but from really different backgrounds. And again, as just mentioned earlier, minimal societal level analysis. What are some harms here? What are some things? Relationships. We found some with interpersonal violence and other aspects. And really, what are the cultural factors there too? So there's a lot more for us to think about on this area as well. So I'm going to now jump into some nuts and bolts of big things. So the first thing we think about is prevalence, frequency, and duration. And the issues we have are a couple. One is that pornography definitions and how we describe pornography is not consistent. And when you have inconsistencies in how you measure something, that's really hard to do. And also, when I ask someone a question, I sometimes might get a different response. So we want to standardize our questions. And a great way to think about that is qualitative research, where we can ask people about questions and see how men and women differ. Do they respond differently if we word questions differently? So it's really this inconsistency we want to address around definitions of pornography. Prevalence rates are also based on self-report data. I don't think self-report data is terrible. I used to do a lot of research on that, and we would put in measures of social impression management and all these things. And we found people are pretty honest, but it would be really much also improved to get objective measures, web tracking, actual device data, things like that, right? And we want to do that from diverse, nationally representative samples. So getting people from all over the country, from every area, rather than selective, convenient sampling. Also, we have little data among racial, religious, rural communities. I think that's under lower income for boys and men. So again, we want to be targeting underrepresented populations, right? Because we really want all voices and experiences to be represented. The other thing is we're looking at associations, again, mostly because it's cross-sectional. You got to use the word associations with both positive, negative, and neutral. So again, looking at more research or having more questions around if there are benefits for some people, what are they and what are the contexts, right? Again, we think about alcohol, I study gambling as well. Well, there's contexts and situations that work for people. And what are those? And what does that mean in terms of research perspectives? So I think that's really important to think about. We also want to look at platform design and algorithms that we really don't know that. And as you know, in the news, there's been lots of litigation, and there's going to be lots of litigation with social media on algorithms and these platforms. And what does that mean for, in this case, for pornography? What are these features and how do they affect people as well? We don't have great data on motivations for use as well. What are the motivations when someone decides to stop or quits or cut backs? What are the factors in qualitative research really getting, rather than a quantitative survey saying, asking people, well, why did you change? What changed for you? What are aspects that where men decided to quit or to reduce, right? So of those experiences. And also we know motivations shift over time, right? So we know that based on relationships, your age, your health, people change their behaviors. And in case for pornography, we also don't know that too. Longitudinal research would help us understand how motivations are related to life stages and circumstances. Because we're talking about mostly young men and boys, but I also think there's a lot of older adults too we should be considering. So we don't really have a wide kind of lifespan kind of perspective. We don't have a lot of longitudinal research in adolescents. It's very difficult to do this kind of research because we know pornography, as mentioned earlier, is very difficult. No one wants to talk about it, but it's happening right among the youth. So I think we need further longitudinal research on youth and young men as well. So, and I think this is long-term studies with self-reports, but also objective measures looking at tracking people's behaviors. But again, among diversity, age, race, relationship status. So we really need that data. We also don't know whether tolerance, so an escalation or someone getting desensitized to certain types of content, we call that novelty seeking, whether that's happening, what those experiences are, and what are the mechanisms there that might impact potentially someone's sexual arousal and preferences, and do those change over time? We also, this came up earlier, we need to distinguish boys who develop, so many boys will be exposed to pornography and many go on to develop healthy sexual behaviors and are doing well, and some don't. Well, why? What happened? What are the protective factors that reduce occurrences of young boys or young men developing these issues? For regulation, if you implement a law, what is the impact in that community, in that state for adults? And is that minimizing or reducing exposure for youth as well? We really need to look at that. We have limited evidence on literacy programs and substance use and gambling. We know educating people is a good thing, right? It often helps kind of reduce harm. Well, we don't have really literacy on pornography, yet we know consistent that kids are using pornography. We don't want to talk about it in sexual health and in class and sex ed, but we need to talk about it, right? So I think we really need to be looking at evaluating school programs' effectiveness, for these things like that within schools, but also working with, families and communities and ed teachers and educators around how do we do this effectively for schools. And I think that's my last slide.
So I wanted to say thank you to Shane, and that really was the perfect lead in for just a couple of quick points that I will make to jump off of that. You raised the point that education is important. And I'm sure that probably many in the audience would agree with that. One of the issues that we're facing is the larger context in which there's sort of a vacuum of sex education more generally. And so part of the work that lies ahead is ensuring that we're advocating for comprehensive and medically accurate sex education and information to be widely available for young people. And that, again, is sort of that base layer or starting point where then we can also have conversations about sexually explicit media. The other thing I think that's worth thinking about is there is an evidence base that education about sexually explicit media can be effective. So my team has contributed a couple of papers on that topic, demonstrating that when you engage youth in conversations that feel meaningful to them, that are sort of evidence-based, science-driven, non-judgmental, and invite them to engage as sort of partners and critical thinkers, that they will, and that they absolutely are capable of learning and absorbing information. I will say here that our team learned pretty early on not to call it porn literacy. And the reason for that is that we got a lot of people misunderstanding what we meant by that and thinking that we wanted children to become very familiar with pornography and very literate about pornography, and nothing could be further from the truth, right? So I switched over at some point to calling it education about sexually explicit media, which is probably a little bit more on the nose, even though there was this field called media literacy. So we had originally just adopted the word porn literacy from that. But anyway, we can all work together on education about sexually explicit media, which is important. And there is an emerging evidence, but our team isn't the only one. I know Megan Moss is here today in our audience, and there are others who have worked hard on developing programs for schools and elsewhere that I think show a lot of promise and are worth that investment. There needs to be political will to fund research that will evaluate these programs. And there needs to be school boards who say, yes, you can implement that here and we can test whether it works. So that's another thing that we have to work on. The final thing that I want to say is that, Shane, you said something that I agree with so much that I just really want to underline it. Protective factors, and how can we enhance those? That really is an exciting step into the future. There are a considerable subset of whether it's young people or adults who are able to consume sexually explicit media and do not experience some of the harms, or maybe experience lesser range of harms or a lesser amount of harm compared to somebody else. So if you can take the people and who are not experiencing harms or experiencing less harms and figure out what's working here, what is making these folks resilient? Why are they able to go on and have healthy relationships, healthy sex lives, and other healthy behaviors? Let's figure out what's going right here and work from there to extrapolate that and figure out if we can extend that to others. I think that would be really exciting, and I hope that other people are going to wind up joining me and saying that they think that that too is a research priority. I'll end there so that we have time to hear from Marc too.
So thank you. And I'll pick up right where you left off, where I do think that that's very important. I think it's important not only for pornography, but also for digital technologies more broadly. So understanding how people are resilient and incorporate digital technology usage in beneficial ways rather than harmful ways, I think is broadly important. And I think that this is particularly important for developing youth, and trying to understand how to do this with pornography is more complicated than for other forms of digital technology use. So with respect to, for example, this transition period from childhood to emerging adulthood with adolescents, some focus group work suggests that younger adolescents and older adolescents have different perspectives on how sexual health, including with respect to pornography, should be taught. And this differs from how parents feel it should be taught and how teachers feel that it should be taught. So it's going to be complicated in this transition period that I think is very vital for healthy sexual behaviors later in life. With respect to the harms that people experience, I do think that understanding how technology operates is an understudied area. So in speaking with people in recovery from problematic pornography use, it has been said that some people have felt like they've been nudged down a rabbit hole where they were directed to more extreme or other forms of pornography that initially would not have been sexually arousing to them. So this gets back to Shane's point about understanding transitions in sexual arousal templates, how people may respond to different stimuli, and how that may lead to people becoming finding it difficult to disengage from pornography. So understanding algorithms, I think, is an area that is under is not well understood at this point in time. And I think that this is an area that warrants more consideration. I think that this balance between healthy and unhealthy patterns of consumption will likely change as new technologies get introduced and incorporated, as has been the case with internet pornography. I think as AI advances and chat bots and how pornography gets integrated into those or vice versa, it may change the landscape in ways that I think we will need to understand better and perhaps think about from regulatory perspectives in a more proactive fashion. So I'm going to leave it at that and hand the baton over to David, I believe.
Well, we've got a great queue of questions. The first one to you, Josh, from Albert. Wondering if there are any correlations between porn use and COVID. And I assume that this mostly means patterns of consumption during.
Yeah, there was certainly a great deal of media attention during the early days of COVID. A lot of it driven by adult websites talking about the massive spikes in viewership that they saw, particularly during the stay-at-home orders and when public gatherings were largely banned. There have been a series of studies. I was able to lead one of them, but there's other groups around the world that have looked at this as well. And the findings are largely consistent. There seems to have been a little bit of a spike in pornography viewing right at the beginning of COVID that quickly tapered off over time, even before some of the stay-at-home orders expired. So largely, I think one of the working definitions or working explanations is that people were bored, they were home, they had a lot of free time on their hands. So they used more porn and then they got bored with that and moved on to other things like sourdough and things like that. I'm certainly sure that some people did experience some harms during that time, but on the whole, at a societal level, it was a very quick little spike that tapered back off to very normal. And actually, as stay-at-home orders expired, we actually saw a dip in overall use.
Interesting. I'm going to look for the paper on substitution effects between sourdough and porn. That sounds like an interesting one. All right, this next question, I'm going to try to collate three here. And Bailey, I'd like to point that I'd actually love to hear, Bailey, from you and Emily on this. So the first of the three is, why is it difficult to get a consistent definition of pornography for research? You wrote about that a bit in the report. A sub-question of that is really a clarifying hint question, but I think a good one from Ollie. What is an X-rated video? I don't know the definition of that. And then there's a related question, not on the descriptive. So those two are definitional, I think, in terms of content, I would imagine, how we classify it. This is more about how we describe consumption. So we hear a lot more about binging, edging, gooning. There are a lot of terms. Sometimes they're conflated. I sense a lot of conceptual clarity. But Bailey, I'm curious for your thoughts on, are we able to come to standard common understandings of what these terms mean in order to research them consistently?
I think this kind of relates to what Marc said too. The landscape is constantly changing. Like even with like phone technology, the technology we have within the last like 2 years, AI too. And where does AI stop? Where does porn begin? Are they all the same? Which like I know we've had conversations around it. There's already places where you can decide what you want, like OnlyFans, and like really being more scriptive of that too. So yeah, I think that comes into why it's challenging. I think another piece is that we haven't had like a place where all pornography researchers really meet to talk about these things, to come up with really consistent definitions.
I have one little mystery in that I could clear up, maybe, hopefully, which is that, and this makes me feel a little old even talking about it, but it used to be that the way to see pornography is that you would have to go to a theater to see a movie. I mean, there were some stag parties where people could bring reels and stuff like that. But for the most part, you had to go to an actual theater. And so the X rating is actually, it was easier and quicker to know if you were seeing pornography because films were actually rated. Is it PG? Yes or no? Is it R? Yes or no? Is it an X-rated movie? And the definition of that was very clear because it had a rating on it right at the beginning of the movie. You know if you're seeing an X-rated movie or not. So probably the general social survey respondents didn't need that much definitional help because it was a very clear question at that time. You know, the other thing that I would say about this question, there's a lot of agonizing about we can't come up with a singular definition and we really need to spend a lot of time all getting on the same page and all using the same definition. Pornography researchers, you are not alone, and you're not the first or the only group of researchers to go through this problem, right? So I can speak on behalf of the intimate partner violence research world or the sexual violence world. We could have meetings all day long talking about what counts as is it physical violence we're talking about today or psychological violence? This is just true for like lots of different fields of research, that there are different researchers out there who are using slightly different tools or have slightly different definitions. And we shouldn't put ourselves through this pain of having to come up with the singular definition that we then try to beg everybody to please use this and only this definition going forward to do your research. Otherwise, we don't understand the results, because that's not true. You don't need a singular definition in order to try to make sense of the world around you and of research findings that help you piece them together and it creates a picture of what's going on and what you need to respond to. So that would be my own 2 cents on that particular issue.
Well, that's a nice nudge away from the definitional vortex. So let's get to something a little more practical. Marc, this is for you from Miles. Any advice for mental health professionals working with men and boys on issues related to pornography use?
So I think it depends on what population one is seeing with respect to men and boys. So it may be if people are coming in into treatment settings looking for help with problematic use of pornography or with other compulsive sexual behaviors, there may be one set of approaches that one might consider using. Some behavioral therapies have shown to be most empirically supported, but and pharmacotherapies have not been. There are no FDA medications with FDA indications for the treatment of compulsive sexual behaviors. With respect to understanding the extent to which pornography consumption questions should be incorporated into general health screening areas, I think that this is an area that one should be considering, but with the mindset that compulsive sexual behavior disorder is a new diagnosis in the ICD-11, and there is no compulsive sexual behavior disorder in the Diagnostic and Statistical Manual. So the extent to which this has been researched is there are less data on how to help people with these concerns. With respect to general health and preventative measures, I think that this is an area that and I'll disagree perhaps a little with Emily, that I think that this is an area that we still don't understand as well with respect to what levels and types of pornography consumption might be harmful during development. So I think that there is still more that we need to do to understand how to get people on the correct trajectories during development.
Shane, for you, what can you tell us about correlations, co-occurrence between different activities? The question here specifically is gaming and pornography, but I'd also be interested in gambling and any other activities.
Yeah, so I would say, mental health things are like bananas, right? Come in bunches. So when we see pornography, if someone has an issue, it's like they're going to have comorbidity, depression, anxiety, and other things. So it's really common. I think substance use can range, but we've been kind of writing consistently on a fair amount of alcohol use, mental health issues. Subpopulations have high rates of trauma, sexual abuse as well. So I think it really depends. I rarely see people who have one issue. So I think they often come in with co-occurring issues. So treatment really needs to be addressing co-treatment and there's approaches for that as well. But yeah, think it's very common with gambling and saying video gaming as well. I think when and why they develop, we're still trying to figure out, but I would just say that it's very likely that they're going to be kind of comorbid. It's my expectation they generally are comorbid. Yeah.
Emily, a couple questions about advice for parents. Like, are there resources for parents? How do parents talk to kids? At what age? Anything you got?
There's a couple articles up there on Common Sense Media. If you go to that website, where there's one for how to talk to your very young children about sexually explicit media or pornography. And there's one advice for parents, including little mini scripts about how to talk to teenagers. So those are really quick and easy, accessible resources. There used to be a website for teenagers called Scarletine that I think is still available. And I would urge parents to go read the information there, which I think is laid out in a factual and accessible manner. And it's a good starting point for lots of parents.
Josh, two questions, not related at all, but one is about methods. Does ecological momentary assessment, when you send out a text message to research subjects and ask them to respond back, is that a valuable method to understand motivations for stopping, starting, and continuing to watch pornography? And the other, a few questions here about AI in porn. I know you have some takes on that.
Yeah. So as far as ecological momentary awareness or EMA studies go, yes, it's a powerful research tool. Those studies tend to be somewhat expensive, so they are limited. This is an area that we're hoping to address in coming years. We need funding. You have to generously compensate participants if you're going to be bugging them with multiple text messages a day and expect them to actually respond to you. But it is a powerful tool. I think even more powerful is emerging research projects that are being conducted right now, looking at actual web tracking, where we can get the actual amount of time that is being spent on these types of things. If you pair those types of things together, you have that web tracking plus EMA, you can actually get a very in-depth view of what they're actually doing and how they're doing. I think the AI question is a big one. And there's a lot of people that are looking at it. Research often lags technological advancement. So we're just starting to generate and push out papers on, OnlyFans platforms and content creator platforms and that type of thing. And that's already being it seems to be supplanted by AI and other things. So we're looking at it. I think that the more customizable your sexual gratification experience can be online, there's a lot more potentials for being enticed to spend more time and money on it. And so I think AI offers that potential, but right now it's all speculation, and we're hoping to have some more answers in the coming months and years.
One last question that came across is about early childhood exposure or consumption. What do we know about? Is that decreasing in age? What are the effects? One of the commenters here pointed to an increase in child-on-child sexual crimes and wants to know if there's any kind of causal link that has been shown with early exposure.
Yeah, the age is decreasing, I think, as we would expect with the increase in accessibility to technology. We're seeing the age just continues to decrease. And that is kind of, I think, a big place where these age verification laws come from.
I don't know the research about early childhood exposures to pornography, but I did work on one study that was about what parents said to their young children when their young children made it clear to them that they had seen pornography. And that convinced me that we have a lot more work to do on because parents were saying everything like, oh, they were just doing yoga, or, they just kind of making things up because they were like deer in the headlights and not sure what to say. And so I think this is a tremendously important issue, and all of the people around younger children need help and need information, need support about what they're supposed to do, what they're supposed to say in the moment, because I think it's happening in communities everywhere. Yeah.
This has been a very rich conversation. We were not able to get to everyone's questions. I apologize for that. We will continue having more of these conversations. You can follow that work at menonline.org. I want to thank the three co-authors of the report and all of the panelists. This has been a fantastic conversation, and thanks to everyone who joined us today.